distractions, and grind. Stay focused, no distractions, and grind.
There are only two types of Americans: those who live in New York and those who wish they could.
Really proud and happy to be here today. This is something that Deputy Mayor Williams Isom joined us, and we continued this important initiative, our CRIB program. It is unimaginable when you think about it. In the city for far too long, mothers were giving birth to babies and then returning back to shelters. And we were clear under this administration that we were not going to continue that system of just a systemic poverty and just a way of stating that we as New Yorkers and government, we are not concerned about breaking the clear cycles of poverty. You know, Archbishop Desmond Tutu had a quote that I always remember: we spend a lifetime pulling people out of the river. No one goes upstream and prevent them from falling in the first place. And we have professionalized pulling people out of the river. Today, this announcement of CRIB is how we're going to prevent them from falling in the first place. Having a child should be the greatest day of one's life. I remember watching Jordan when he was born and how proud I was, and I knew the awesome responsibility of being a dad. But it was a proud moment for me, and it's definitely the way millions of New Yorkers should feel when they give birth to a child. And on that day, you should not have to worry about where you're going to take your baby to. You shouldn't have to worry about if you're going to return in an environment that's not conducive to a child upbringing. You shouldn't have to worry about whether your child will grow up on the verge of homelessness or in a home. And nothing is more important to our city's future than making sure every young person, they're ready for the future that's ahead of them. And that starts with a place for them to live the moment they're born. And that's what we're delivering with the launch of our new pilot project, CRIB, C-R-I-B, an initiative that aims to create real impact at birth by putting pregnant New Yorkers on a path to permanent housing. This is an $8.5 million program. It will provide pregnant New Yorkers with housing vouchers so they can quickly move into stable homes before the child is born, And early this year in our State of the City address, we made a commitment that no child should ever be born into our shelter system. And that is what CRIB is all about. It's part of this $650 million plan to tackle homelessness and severe mental illness, and to ensure New Yorkers have a safe, clean place to come home to. In fact, by ensuring mothers and babies do not enter a shelter after leaving the hospital, we are breaking the cycle of poverty and housing instability before it starts. In 2024 alone, over 2,000 babies were born in New York City shelters. Just think about that for a moment. Over 2,000. That's 2,000 too many. And with every housing voucher that these CRIBs program will give to family, it will connect New Yorkers while diverting pregnant parents from shelter and improving their health services and outcomes, so that our most vulnerable New Yorkers can find the affordable housing they need and get the start in life that they deserve. With CRIB, we are ensuring that families are supported and are able to live in a city that is safe and affordable. This is also another example of how this administration is cutting through the red tape of bureaucracy to give the resources to families when they need it. And that often prevents people from getting the government services on the timely manner. CRIB doesn't just further our mission to make our city the best place to raise a family, it builds on a record of doing so. Since coming to office, when you think about it, how we have moved people out of homelessness into permanent housing, and a record number of individuals in shelters, with nearly 37,500 New Yorkers moving into subsidized units last fiscal year alone. An awesome job and responsibility of Commissioner Parks and her team. They have really leaned into breaking this record of getting people into permanent housing. Even when we were facing an asylum seeker and a migrant crisis with 237,000 migrants and asylum seekers, over 90% have gone on to the next step of their journey. Now, one child or family slept on the streets of the city of New York, and history is going to be kind to that record when we start reflecting on how great this administration has done when it came down to people in need. Starting a family is one of the greatest joys one should have, but barriers and negative reactions have prevented that joy from being what it should be. So we are not just ensuring that pregnant mothers have housing, we're making sure that families have the support they need. And earlier this year, we launched our New York City Baby Boxes, which sends family homes from hospital with vital supplies and resources, including diapers and wipes, clothing, games, and guides, and what to expect after giving birth. These items that we see here, trust me when I tell you, it goes a long way when you don't have to determine what you will put on your table to eat and buy the supplies for your babies. This is a great way to start off with your child and the support and information that they need. New York City Baby Boxes will reach approximately 7,000 families across our public hospital system. 7,000 New York families will be leaving the hospital with diapers and clothing and other supplies. 7,000 that can have peace of mind that they have the resources they need to get an early start. And when you add this with what Deputy Commissioner Mark Stewart and Community Affairs in the Police Department with his various baby supplies that he has given out to over 20,000 families in this city. It is how every agency is on board for doing what is right for the children and families of the city. We're helping ease the financial stress of new families and making New York City more affordable for them. Our children are the next generation, and our next generation starts now. And many times and far too often, we look at these stats and create them as just numbers on the pieces of paper, but it's not. It's individuals. And far too often, we have denied those individuals the access to government that they deserve. And nothing personifies that more than our next speaker, Tatiana Mitchell. She's a career participant, and her baby is going to have the early start in life that they deserve. I want to bring it now, Tatiana.
My name is Tatiana Mitchell. I'm 25 years old. I am a lifelong New Yorker. I live in Queens, New York, and I recently fell through rough times and had to go into the shelter in mid-September. I am currently 3 months pregnant, and I am excited to start my new chapter in my life. But I know I also need a stable housing to care for my baby. When I went into the PATH Intake Center run by the Department of Homeless Services, I was immediately greeted by people who wanted to help. They told me because I am pregnant, I am eligible for a new program called CRIB that specializes in helping pregnant women like me. They let me know that I could move in with a family member who receives support to house me and my growing family, or get a city FEPS voucher so I can afford my own housing. The program has been great in moving to help me quickly and really show me that they care about me. I work a seasonal job, and I am currently on interviews to get a full-time work. With the support of the city and the Adams administration, I am excited what my future will hold for me and my baby, and my partner, Javon, who is here with me today. And now we'll be introducing Commissioner Park.
Hold on. Is that's your boo? Come on up here, man. You should be up here with us. Come on. Love it. Go ahead, say a few words, man. Always trying to leave the men out.
What I would like to say is thank you for the Adams family and the Adams commissioner because the steps that we take and the life that we live in this New York City, we know it's not always easy. It's a rough path that we have to deal with. But with the help of everybody that's a part of the system, I think that we have a better chance of getting there.
Thank you.
Thank you.
Good luck to you.
Thank you.
You're a boy or girl?
I'm not too sure yet. I think it's a girl.
Good morning. Having a baby is both a wonderful life moment and immensely challenging. My baby is now 20, but I still remember very distinctly both the joys and the stresses of those first few months. That time is profoundly important, both for the family and for the baby. The instability and, frankly, trauma of homelessness can have lasting impacts on an infant. And with over 2,000 babies born in shelter in 2024, there's no bigger way to impact a child's first days on this earth than to ensure the child is born into a stable home. With CRIB, Creating Real Impact at Birth, we're working creatively and strategically to break the cycle of infant homelessness. Our goal is to identify the best tools to connect parents facing homelessness to permanent housing in real time so that their babies will be born into stability. CRIB is a pilot to study the impact of housing stability on the newest of New Yorkers by providing expecting mothers housing support to avoid entering shelter. Through the pilot program, DSS will identify more than 300 pregnant people who are applying for shelter and assign them to a housing subsidy, either the rental assistance program City FEPS or Pathway Home, which pays people to stay with friends or family. This will allow them to more quickly move into stable homes before their children are born. The pilot builds off our experience serving families over many years. For example, during COVID, the number of families with children entering the shelter system dropped significantly. One of the reasons for this is that the substantial federal income supports meant that families could afford to stay together. We know that the city has a historically low vacancy rate, and it's hard to go out and find an apartment. So we're looking to see if we can support people to stay with their friends and families in a moment of great change for them with Pathway Home. And as for City FEPS, DSS helped nearly 32,000 individuals obtain permanent homes or stay stably housed through City FEPS in 2025, reflecting a threefold increase in the number of new households using the voucher since the launch of the program. Today, more than 60,000 households, or more than 136,000 New Yorkers, are using City FEPS for their housing. This reflects a more than 200% growth in the program since its launch and makes City FEPS the second largest rental assistance program in the country. Through CRIB, we are looking to evaluate these two different models to see which one best helps pregnant people either avoid shelter altogether or have very short shelter stays so that we minimize the number of babies born in shelter. Thanks to Mayor Adams, this is an innovative program that we anticipate will lead to improved outcomes for families and babies during a transformative and precious, yet also deeply vulnerable time in their lives. I want to say a big thank you to the DSS staff who took my crazy idea and turned it into reality, and particularly to the two deputy mayors who are here who have championed the work from the very beginning. And now it is my great pleasure to introduce New York City Health and Hospitals Chief Women's Health Officer, Dr. Wendy Wilcox. Thank you.
Good morning, and thank you.
Good morning.
Mr. Mayor, deputy mayors, thank you all who are here for joining us at New York City Health and Hospitals, Kings County, today for this special announcement. My name is Dr. Wendy Wilcox. I'm the inaugural Chief Women's Health Officer for New York City Health and Hospitals. I also was previously Chief of Service here at OBGYN because I am an obstetrician gynecologist, so in case you need anything, I know it's too early, but we'll see. We know that the first few months of parents' and babies' lives together are extremely important. The less that they have to worry about some of the essentials, the more time they have together to bond. That bonding is incredibly important for the lifetime health of both the baby and the mother. Relieving this stress is so necessary for a future of health and for the health of the entire family. That's why these baby boxes are so important to birthing families. Not only do they take the burden off of new parents, allowing the time to care and bond with their newborn, but also to take stress out of their lives. The baby boxes, along with the crib program that you just heard about, are to make sure that all of those outside stressors will be relieved. These baby boxes are going to be available for all birthing families. You heard me, all birthing families who deliver at our 4 sites that have the most deliveries within the system. These would be Kings County, Elmhurst, Lincoln, and Jacoby. I want to thank the mayor and the deputy mayors for their commitment to New York City Health and Hospitals and the families of New York City. I also want to thank Welcome Baby and the United Way, as well as both the City Hall teams and the central office, Women's Health and communications teams for really making this become a reality. We know that New York City loves babies, and just in case you had any doubt, New York City loves babies. We know that this program, the baby boxes and the crib program, will make a difference. And now I will introduce Deputy Mayor Suzanne Miles-Gustav.
Thank you. Thank you so much. Good morning. It is such a pleasure to be here with all of our health and hospital heroes. Wonderful room to be in. But from day one, I think you heard the mayor say, the Adams administration has made supporting children and families a core focus, not just a policy priority, but as a reflection of our values. Project Crib is a powerful example of what it looks like when we bring our health and social services systems into alignment, treating housing not as separate from health, but as essential to it. We know that the conditions into which a child is born shapes everything that follows: development, health, family stability, even long-term opportunities. When a newborn enters the world into shelter, that child and their parents are already facing trauma, stress, and barriers to care. With Crib, our Creating Real Impact at Birth, we are piloting an approach that meets families at the exact moment when coordinated support can make the greatest difference. It's smart government, but it's also deeply human government. This initiative reflects our administration's belief that early intervention works, that prevention is powerful, and that health and housing outcomes improve when we connect people to the right services and resources at the right time, before crisis hits. It also reflects a broader shift we're leading across city government, and that's integrating care, moving away from fragmented systems toward ones that see families holistically, not as cases or numbers, but as New Yorkers who deserve to thrive. Thanks to our partners at DSS, to our healthcare providers here at H&H, and to Mayor Adams for working to give every child a strong, stable start at life. This is really what it means to put families first. And I have to give a huge, huge, huge shout out to my predecessor, for whom this would not be possible without her vision and commitment. And I want to bring former Deputy Mayor Ann Williams-Isom up to say a few words.
Good afternoon, everyone. Yes, my title was former Deputy Mayor, but 10 weeks ago I got a new title. The title is Gigi Ann. We have our first grandchild 10 weeks ago. My whole life, I have been a child advocate, so I know all the research. I have seen the data. I have 3 children of my own, but I will tell you that seeing my daughter and her son-in-law these past 2 months right before giving birth, has given me a refresher course that I didn't realize I needed, about how vulnerable you are, how fragile, and frankly, how sacred this time is. And so it has been so important for me to come from my Gigi duty to come and to tell you, I spent so much time talking about adverse childhood experiences, and we study all the negative stuff. We study what happens if a child has a death in the family or if they experience homelessness, but we know what works. We act like we're on Mars. Was it surprising you to hear that if a child is born into shelter that is traumatic? I saw my daughter and my husband and I picked her up with flowers and all kind of stuff, and I saw that glaze in her eyes because of what she was going through. And she was going through a beautiful apartment on the Upper West Side with people to help her. And the child, 33 years old lawyer, looked like she had, deers in the headlights. What is it that we don't understand? She had complications with breastfeeding, and I didn't know what to do, but I called my 95-year-old mom, and I was like, Mom, how do we do this? And people that we could call. I don't even want to call it services. I want to call it supports, because it is something that we all need, no? Yes?
Yes.
And so we sit up here and we act like this is an amazing thing, but to say something so profoundly like no child should be born in shelter. When the mayor said that, we all kind of went like, oh yeah, that's nice. You guys should clap for that. That is a bold vision of saying that this is the way the world is, but we can do something different. Yes? And we can do it together. We talked about commitment. We talked about what the science says, which is why I love this so much. But we need to say the word love. If we loved all children like I love Noel, we would make sure that they have all of this and more. And it is possible for us to do that. Noel's middle name is Ijeoma, which means safe journey. Her dad is from Nigeria. And Ijeoma safe journey doesn't mean when she goes to school, or when she gets a good early childhood program, or when she goes into a good college. It means from the moment she's born. I'm gonna say one last thing. When I go into the room and she hears my voice, she's 10 weeks old. She doesn't know me from a hole in the wall, but she knows that someone is coming to help her, that when she cries, someone will be there for her to pick her up, to comfort her, to give her a bottle that's the right temperature, to hand it to her mom. You guys, we can do this. We can support moms and these fabulous dads that are here to do better for our children if we want a better world. I want to say thank you to all of the folks at the Department of Social Services, Health and Hospitals, Department of Health, all of you, because it's a crazy time. But what you do is you continue to put your head down in the midst of, like the mayor used to say, block out the noise and just do what you need to do. And we see that and we appreciate it. Lastly, I want to say something about Mayor Adams. We could say a lot about Mayor Adams. What I will say is that what I have always admired is his commitment, his compassion, and his superpower, which is his proximity to pain. When there was any situation, whether it was a homeless person, a person with severe mental illness, he doesn't go away from it. He doesn't lean back from it. He leans into it. Sometimes I was like, we need to lean back. I don't want to do that, please. He was just talking about the asylum seekers, and I feel like I have post-traumatic stress system. But he leans in, and so I appreciate you dearly for all that you have done, and especially for the people that we love and the folks that are the most vulnerable in this city. God bless you all, and thank you very much.
Thank you. And I'm looking around the room, and I'm seeing the faces of this amazing hospital. Sheldon, thanks so much for allowing us to host this here. As we were walking up the steps, Sheldon was sharing with me, the chief executive officer was sharing with me, you had 102% capacity. And you're seeing the byproducts of COVID, many of our young people dealing with severe mental health issues. They're finally coming out and talking about it. And so I just want to say thank you. This hospital, I represented you as a state senator, as the president. You have always been on the ground, and your staff here is just amazing. Whenever we called on you, you're always there, and we cannot thank you enough. This is a quality hospital in a community that needs quality care. So where I say this, and I'm so glad what the deputy mayor stated, we have just put so many things in place to build on. We are leaving this city in good care, folks. What this administration has done, whomever comes next, they need to build on what we have done. We're handing off in this relay of life. No one runs the whole relay. There's a team behind it. The baton we're handing off, we're giving everyone a great lead, a great foundation. We cannot mess this up. We can't go backwards. We have to continue to lift up children and families in the city. So we'll ask a few questions before I bounce.
What's the approximate value of the baby box?
H&H, do we have approximate values? You come up to the microphone.
I'm Sarah with Welcome Baby. The city is investing about $200 in each of these boxes for families who need them.
Hi. So a few questions. On the baby box, are they customized to the mother? Because every mother's different when they're pregnant and for their child. I also was wondering about the city FEPS voucher. Those people that already have vouchers complain that it's difficult to get into apartments. So what's the work being done so that the mother actually gets in before she's due? And then I heard it's a pilot program. Does that mean it's only going to go to the end of this year, or it's going to be able to be funded into the next year?
I can talk about the first question. These are the core essentials that really every birthing family needs when they bring a baby home from the hospital. So this really does satisfy all of those basic needs of a newborn and a postpartum mother in that first 4 weeks and frankly beyond. I would.
Yes.
So you're absolutely right that the tightness of the New York City housing market is an immense challenge for everybody, and that's one of the reasons why we are really testing here two different housing pathways. There's City FEPS vouchers, but we're also working with Pathway Home, which is a program that helps cover costs when people are staying with friends or family. We are really structuring this so that we understand what works best for parents when they are on, a very specific timeline for getting housing. And I think, at least one theory is that Pathway Home may be a good interim solution to help people address the fact that we do have a 1.4% vacancy rate in the city. With respect to the pilot, it has been funded over a 5-year period.
And that's why we have to build more housing. That's why we zoned the city for 426,000 new units of housing with our City of Yes program, the most comprehensive housing program in the history of the city. That's why we build more housing in year 1, year 2, and year 3 in the history of the city. Our program is more than 12 years of Bloomberg, 8 years of de Blasio combined. We did it in 3.5 years. That's why more people are participating in the FEPS voucher program, getting housing than any other administration in the history of the city. 3,500 people we moved out of street homelessness into permanent housing, 1,000 off our subway system. We did it. And now the next guys have to do it. Thank you. Thank you all. Thank you.
Yeah, I'm out at Brooklyn. Now I'm down in Tribeca, right next to the Narrow. But I'll be hood forever. I'm the new Sinatra. And since I made it here, I can make it anywhere. Yeah,